Hello, assalamu alaikum. This is me, Dr. Jahangir, and you are watching me on my YouTube channel, that is Dr. Jahangir Khan. Well, I have started lectures on respiratory failure. So this is my second video on respiratory failure. You can watch the previous video in which I discussed what is respiratory failure, what is the criteria of respiratory failure, what is type 1 respiratory failure, what is the mechanism of type 1 respiratory failure, that was VQ mismatch. I have already discussed in my previous video in detail. Then I talked about the causes of the type 1 respiratory failure, and then I discussed the treatment. If you know the mechanism, the VQ mismatch, you can find out the diagnosis and you can treat accordingly. Now today we are going to discuss about type 2 respiratory failure, very important topic for not just only pulmonologists but also for each and every physician as well as surgeon. Because most of the time we receive calls from other wards regarding type 2 respiratory failure, how can we proceed, and whether we can do surgery or not. So if you know the mechanism, you know the diagnosis. If you know the diagnosis, you can treat the patient. So in type 2 respiratory failure, you are having two categories. Category number one is whether this cause is the central, now this is very important, or peripheral. This is very important regarding the mechanism of type 2 respiratory failure. If you know this thing, you know the diagnosis, and if you know diagnosis, you can treat the patient accordingly. Now central mean the brain. Central mean brain. Now if the cause is central, and peripheral mean outside the brain, means periphery. So over here we are having outside the brain. So what are the causes inside the brain? We are having a stroke if it involves the respiratory center, especially the brain stem stroke. We are having a space occupying lesions. We are having a stroke, and we are having drugs intoxication. Now this is very important. We are having benzodiazepine, which can cause a respiratory depression and which can cause a type 2 respiratory failure. We are having opioids. These can cause central decreased respiratory drive and lead to a type 2 respiratory failure. Now outside the brain we are having causes. Either the lung is the culprit, now this is very important, or outside the lung. Again, outside the brain is divided into two. Either the cause is in the lung, or the cause is outside the lung parenchyma. So if it involves the lung, we should think of obstructive airway diseases. If it is the lung, we should you should think about the COPD. You should think about the asthma. You should think about the bronchiectasis. You should think about respiratory bronchiolitis, RBILD. You should think about the obstructive causes. If it involves the lung, you should think about the chronic bronchitis. You should think about the chronic emphysema. That can give you type 2 respiratory failure. Now, what are the causes outside the lung? So we are having neuromuscular disorders. Now this is very important for neurologists. From neurology point of view, this is very important. If you are having a neuromuscular disorder, if you are having a motor neuron disease, if you are having a myasthenia gravis, and if you are having a GBS, which involves the diaphragm and respiratory muscles. So in that condition, that can give you type 2 respiratory failure. You are having a chest deformity. Like for example, say kyphoscoliosis. Kyphoscoliosis or scoliosis, in which there is a deviation of the vertebral column. It can cause restrictive lung disease, and that can cause what? Type 2 respiratory failure, because the tidal volume is decreased. The respiratory rate, though, is increased, is a compensatory process, But what type of scoliosis gave you? A type 2 respiratory failure. We are having causes like obesity. Now this is a very important. Every time when I have having ER, I see in the ER the 4 to 5 patients which are labeled as a COPD. But when you examine the patient and ask the history, they have a typical history of a nighttime snoring, they are having a morning headaches, and they are having a daytime somnolence. So that is actually obstructive sleep apnea syndrome, obesity hypoventilation syndrome. This is very common as compared to the COPD and asthma, because nowadays our lifestyle, you know about that, we are having sedentary lifestyle and fast food, so we are more prone towards obesity, and every third or fourth patient is obese. Now there is something which I would mention over here. A patient come to you in ER, he was all right, but when you nebulize the patient become unconscious. Now this is very important, because when you nebulize the patient, we give high oxygen. And when you give high oxygen to these patients in type 2 respiratory failure, what will happen? They will retain the CO2. If they retain the CO2, what will happen? That will lead to CO2 narcosis. That will lead to CO2 narcosis. We will discuss in details regarding the obesity hypoventilation syndrome, obstructive sleep apnea syndrome, how would you treat them, what is COPD, asthma, regarding the inhalers, and all of this stuff in my next coming videos. Right now, you should learn type 2 respiratory failure. How should you proceed? Central, peripheral, central causes, peripheral causes, outside the lung, inside the lung cause, outside the lung you are having these causes, inside the lung you are having this cause. That's all for today. Please do subscribe my channel and also press the bell icon so that you can get notification on my new video. And also do share my channel. Thanks.